We're going to next assess the heart, anterior and posterior chest. Using the bell of the diaphragm, or we're going to use bell and diaphragm. We're going to check the aortic, which is the second intercostal space on the right sternal border. We're going to check the pulmonic, second intercostal space on the left sternal border. We're going to check Erb's point, which is third intercostal space on the left sternal border. We're going to check the tricuspid, which is the fourth intercostal space, left sternal border. And we're going to check the mitral, which is fifth intercostal space, mid-clavicular line. And we're going to switch and check everything all over again. Aortic is second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, which is third intercostal space, left sternal border. The tricuspid, which is the fourth intercostal space, left sternal border. And the mitral, which is the fifth intercostal space, mid-clavicular line. Next, I'm going to auscultate the anterior chest for lung sounds, beginning in the intercostal spaces, and make sure that the breath sounds are clear bilaterally. Good deep breath. Again. All right. Intercostal spaces are clear, both sides. Now we're going to do posterior lung sounds using the 6 areas starting between the shoulder blades. And I want to be sure to get the right lower lobe of the lung by checking that lateral lower side. All lung sounds are clear bilaterally. The next thing we're going to do is assess hand grips. So I'm going to have you squeeze both sides, and the hand grip strength is 5 bilaterally. We're going to assess the passive range of motion of the elbows using flexion and extension. We're going to assess the strength of the biceps and triceps bilaterally by having the patient push and pull against resistance, and that is a 5 out of 5 strength bilaterally. We're going to check the passive range of motion of the shoulders using flexion, extension, internal rotation, internal rotation, external rotation. We're going to do abduction and adduction. Next, we're going to assess the cerebellar coordination with rapid alternating movements and have you to check using your fingers and thumbs back and forth, and then hands on your legs, and we want you to flip-flop back and forth. Okay, those are normal and well coordinated. The next thing we're going to do is check the DTRs. Let me get my... We can do this. I'm going to check the bicep first. By supporting the patient's arm, I'm going to put my thumb here in place in the medial aspect, and I'm going to strike my thumb with the end of the hammer, and I'm feeling a good contraction. Let's have you sit up here. We'll move this around. And we're going to check the patellar reflexes. Having your patient to relax their leg. We're going to find the notch, and we're going to check the reflex. The next thing we're going to do is the Achilles. And so with the foot relaxed, and I'm going to dorsiflex the foot with the flat end, I'm going to check for the patellar reflex, and the patient has pronation with that. The next thing we're going to do is an abdominal exam. So I'm going to have you lay down. Let me check and make sure you can see on camera. We're going to auscultate the bowel sounds in all 4 quadrants. You want to start with the right lower quadrant, working up to the right upper, and then left lower. And bowel sounds are present in all 4 quarters. The next thing I'm going to do is auscultate for bruits with the bell, and I'm going to check the aortic, which is midline below the xiphoid process. The next I'm going to do is the left renal, which is above and lateral to the umbilicus, so you can find the umbilicus and check that. And the opposite. The next is going to be the iliac, so that's going to be below the umbilicus on either side. And no bruise are noted. The next thing I'm going to do is percuss in all 4 quadrants for tympany, dullness, flatness. All right. And those were all normal on exam. The next thing we're going to do is palpate all 4 quadrants for tenderness and masses. So we're going to start with the right lower, any pain? Right upper, any pain? Left upper and left lower. Okay, no pain. So that is normal exam with no tenderness or masses noted. The next thing I'm going to do is palpate the liver. I'm going to place my left hand under the patient, look for the midclavicular line on the right, and I'm going to put a palm upward at the right edge of the costovertebral angle while the patient takes a deep breath, and I'm going to push down so I can feel the lower edge of the liver. Okay, deep breath. All right. The next thing we're going to do is a spleen exam. So I'm going to have the patient turn towards me. And we're going to, with the knees bent, place the left hand underneath, and again at the costovertebral angle, I'm going to push down as the patient takes a deep breath. Deep breath. All right, and I do not feel the spleen, which is a normal exam. All right, and have you sit up. And we're gonna next do range of motion of the lower extremities. So actually, I do need you to lay down. Sorry about that.
That's okay.
The first thing we're gonna do is flexion. So we're gonna bend the knee up, and that flexes the hip, and then we're gonna straighten it out. We're gonna do a abduction, which is away from the body, and adduction, which is towards the body. We're going to do an internal rotation and an external rotation. There's internal, there's an external rotation. So the range of the motion on the hips was normal. The next we're going to do is the knees, which again, you're flexing the knee and you're extending the knee, and those are normal. We're going to assess the strength of the knees by having the patient bend and put their feet flat. I'm going to have them pull and push, all right? And I can check the strength of the knees bilaterally. The patient has a 5 out of 5 strength bilaterally on that exam. The next thing we're gonna do is a passive range of motion of the ankle. So we're going to do a dorsiflexion, a plantar flexion, and a rotation. Oh, let me move this. So dorsiflexion, plantar flexion, and rotation, okay? Then we're gonna, that was all passive range of motion. Now we're gonna assess the strength of the ankles by having the patient to dorsiflex and plantar flex against resistance. And she has 5 out of 5 strength equally bilaterally. The next thing we're going to do is a range of motion of the spine. So I'll have the patient to stand, and we're going to check flexion. So have you reach down and touch your toes. All right. We're going to do an extension. So you're going to push back. All right. Give your patient a little bit of help so they don't fall. We're going to do a lateral flexion, so we'll have lean to the side and the other side. We're going to do a rotation. Okay, rotation, back and forth. So the patient has good active range of motion. Our final exam is the Romberg, so I'm going to have the patient to close their eyes for 20 seconds. I'm going to make sure that they do not fall. And I'm not observing for any instability. All right, that's fine. So none is seen, which means it's a negative Romberg test.